We're fortunate to live in a region with access to excellent healthcare and opportunities for higher education. We have some of the best colleges, universities, hospitals, and community health centers in the nation that are healing and teaching people from all over the world. And they are driving the economic success of Massachusetts through job creation, tax revenues, and other forms of economic impact. But in this moment, they are facing some significant challenges. The Eds and Meds. We talked to some of the leaders of these industries about the impact that they have in Massachusetts. Let's hear what they had to say.
The state of Eds and Meds in Greater Boston is the envy of the nation.
People come from around their world to get care here, to learn here, and to give care here.
The combined power of the educational and medical institutions is unparalleled.
The overarching threat is the degree to which the general public is questioning the value of higher education and the importance of Eds and Meds to the Massachusetts economy.
Mass General Brigham is the largest healthcare system in Massachusetts. We employ about 85,000 people. That makes us the largest employer in Massachusetts.
UMass has 73,000 students. We're the third largest employer in Massachusetts with 26,000 employees.
Beth Israel Health is a relatively new healthcare system. We have almost 40,000 employees.
We have 16,000 students here, and there are about 120,000 students in the community college system.
Over 14,000 individuals work at Boston Children's.
We are an institution of about 6,500 students across 3 schools. We have approximately 1,200 employees at Suffolk University.
These aren't jobs that are just research jobs or just faculty jobs. These are jobs in all kinds of sectors, and it's really important to the economy, and it's really important that we get the message out.
The economic effect that we have in the communities that we serve goes well beyond the employees in the systems. We are in every community out there. My system in Eastern Massachusetts has primary care physicians within 5 miles of every single person who lives in Eastern Massachusetts.
We are home to some of the top universities in the entire country, in the entire world. We educate, we train, we keep people here in Massachusetts. We often set the standard of how care is delivered.
Students coming into this state with their ideas, with their intellect, with their passion is unparalleled. We see every day the innovation, the development of jobs. It just is an economic engine for the state.
Every city and town is getting benefits from colleges and universities in some way. And the research that colleges and universities and hospitals do together are not only supporting the economy, they're supporting our actual health.
We're in really an unprecedented time. The number of challenges that we face as caregivers isn't remotely like anything that I've ever experienced in my 30-plus years. Reimbursement and policy from the federal level and the changes that are demanded of us and our workforce are not like anything else that we've seen in the past.
The state of Eds and Meds in Massachusetts is fragile.
The state of Eds and Meds in Massachusetts is at a critical juncture.
We all live in an ecosystem. So if the research institutions like Harvard or MIT or Wellesley are not being able to carry out the high level of research that they do, that has a rippling effect on all of the other folks who are supplying the sector.
We are the #1 pediatric research entity in this country with over $300 million of NIH funding. Those dollars flow from Washington, D.C., and they impact every aspect of the Commonwealth's economy.
As the largest recipient of NIH funding, Mass General Brigham is thinking about this. What does it mean for research? What does it mean for clinical care informed by research? What does that mean for everybody?
The partnership between colleges and universities and healthcare systems in Massachusetts is so important, not just to the economy, but to the health of every individual. Cures, everything from vaccines to better cancer treatments, really are dependent upon the work that happens together. Without it, the cures of tomorrow and 5 years from now and a decade from now may not happen at all.
We should not assume that the place that we've held in healthcare around the world is a place that we'll continue to hold if we don't continue to work at it, if we don't nurture it.
We need to show the world with numbers and with data that is real, that's sustainable, to be in the same ecosystem.
Massachusetts has led the world in medical research and higher education, and that's at risk as long as the United States doesn't maintain its commitment to research.
We have the ingredients, we have the people, we have the talent, we have the ecosystem. But we have to remember that keeping education, healthcare top of mind will keep the ecosystem so intact, so robust, that we can keep on claiming that well-deserved leadership around the country.